Good.
So today is June 2nd, 2020, and we are here with Father Tam for the Houston Asian American Archive. Thank you so much for your time, Father Tam. To start, would you like to briefly introduce yourself?
Yes, my name is Father Anthony Tam Pham. I'm a Catholic priest currently practicing, helping in the Archdiocese of Galveston, Houston, and also I'm a practicing physician, and I have my own clinic.
Okay, great. I heard that you closed up your office for 3 weeks and went to New York to serve the COVID-19 patients in the hospitals. Can you talk a little bit about what you've been doing there?
Okay, I went up to New York for about actually at the end of March. As I was watching in the news in the morning, I saw that the governor of New York, Governor Cuomo, was asking medical professionals around the country to come and help New York City because they were overwhelmed with COVID patients and they were understaffed. And many staff were infected by the viruses. So responding to his call for help to the New York City, I was preparing my clinic to close for about 5 weeks because I know that I'm there for 3 weeks. When I come back, I'll be quarantined for another 2 weeks. So I was preparing clinic to close for 5 weeks. And also another response to the Cardinal Donato here in Galveston, Houston, that he was calling our priests to pray harder and also to work harder. And he was using the image of Jesus on the boat, that Jesus was sleeping and then the disciple was calling on him. And eventually that he wake up and calm the storm. So as we work harder and pray harder, that somehow that Jesus will wake up and calm the storm. So that's how it happened. So I arranged myself and I went up to New York for most of April of 2020 and helped at Elmhurst Hospital in Queens in New York.
Okay, so what you have been doing there? Like what kind of job or work you've been involved in during your time in New York?
Okay, so when I went up there, I went to the health department of New York City and signed up to volunteer. And of course, I have to prove myself that I'm currently practicing medicine and a medical professional with all my active license. They asked me where I want to work. And I said, I'm up here for 3 weeks to volunteer and I want to go to where it is business and it's more hardest hit. So he said that I go to Elmhurst Hospital in Queens. That was the epicenter of New York. Most hard hit, the most severe patients, and most on the staff. So I went there I went to serve at Elmhurst Hospital for 3 weeks. And when I went to Elmhurst, I was assigned to a team called palliative care team. Palliative care team means that we deal with end-of-life situations. We work mostly with the ICU patients, and those patients, most of them were most severe, and most of them did not make it through the epidemics. So what we do is, number one, help them with the pain issue, help them to feel more comfortable with their pain. Number two is also that we contact the family to deal with the end-of-life issue, meaning that we present their medical situation at that time to the family and ask the family to consider how they want to treat their loved one, whether do they want to resuscitate, meaning DNR, or do not intubate, because for most of those patients, of COVID patients end of life, these treatment may not be helpful for them. In reality, it may prolong their suffering. So we wanted to present to the family for further consideration. Also, another aspect that we helped the family with was for them to be able to see their loved one, because the hospital was isolated from outside. No family members can come to visit their loved one. So we use the iPhone, or we use the phone to FaceTime their loved one. So the family was able to see their loved one in the ICU, and most of the time they cry, they pray for their loved one, they say a few words of goodbye, and these usually were at the end, the last 10 or 15 minutes that their loved one were able to see their family member who was still alive. Um, that's the medical aspect of my work. Furthermore, as the Catholic priest, that I was able to exercise my priestly vocation, meaning I was anointing those patients. Sometimes people use the word the last rite, that I was giving the last rite to those patients to pray for them. And the family member was able to see that I was pray for the member, for the loved one, and to anoint, to pray, to give the oil to the loved one. So it's a great comfort for family members as well.
Mhm. That's wonderful. Well, I'm so impressed to hear a story of going against the flow when everyone is trying to escape New York. So could you share with us one of your most memorable experiences in New York?
I think the most memorable experience would be to deal with family members, because it was a highly charged and highly emotional situations. Um, when when the patient was taken to the hospital, most of the time they lost contact with the family members at home. Sometimes to call on the first day get to the ICU, they were and most. So I think the most emotional or memorable experience was to help the family to deal with the end of life issue of their loved one, and especially to comfort the family, to pray with them, and to comfort them. I think that's one of the most memorable experience. Um, Even more so that when it happened to the younger patients, most of the time we think that people most suffer were older patients, that they were most affected by the COVID. But many patients that I had was younger patients. One was 25 years old lady. Another one was about 29 years old, young, strong man, and many of in the 30s and 40s. And it was more difficult to see those patients, gradually uh, becoming unconscious and then gradually die, yeah, in front of your eyes.
Mhm. Yeah, this is very sad to see, I believe. So,
Mhm.
is there anyone like who you find very inspiring during your time there?
One more time.
Oh, are there any people who you find inspiring to you during your time in New York?
Oh, absolutely. Um, a lot of my coworkers were really inspiring to me. I was there for only 3 weeks, but many of my coworkers are staff at the hospital, and they have been fighting this wars in the beginning, in March, and they're still fighting now. and and what they did at the hospital was truly sacrificial and inspiring. They, in a way, they gave their life for their patients. Every time that we walk into the patient's room, it is the time that our life is threatened. You know, viruses everywhere, and we don't know how much the room was infected, because patient has been staying there for so long, for a couple of weeks already. So who knows how much infection the room was. So every time that a doctor or a nurse or medical staff walk into the patient's room to help them, that's when they're facing the challenge, they're facing danger in their life. And every day they come to work with the most cheerful attitude and the most motivational attitude. So it's really inspiring to see how medical staff work day in and day out in the danger of coronavirus.
Mm-hmm. Yeah. Is there any like a specific case or story that you would like to share?
A specific case in terms of the staff or in terms of the patients?
Either you would like to talk about.
Yeah, I think my mentor, I think is she was very inspiring, Dr. Tita. She is she's in charge of the palliative care team there, and she was very involved. She was very understanding. She had a very vast experience in the past. That when she talked with family members, especially at the end of time issue, she was very gentle and very understanding and present the situation very accurately. So the family was able to assess the situation and to feel comfortable to make decisions. And oftentimes those are very difficult decisions in their life.
Mm-hmm. Oh, I think you cut off a little bit. Do you mind repeating your last sentence?
Say it again.
Oh, do you mind repeating your last sentence? I think you cut off a little bit. Like
oh, okay. So answer the last question again.
Oh no, the last several sentences, I guess. Like
I'm not sure where to start.
Oh, okay.
Do
No,
you want me to answer the whole question?
No, never mind. I think it's fine. I guess it's just last several words. Yeah, it's fine. So I guess my next question is, since you mentioned you're on the palliative care team, how do you feel after witnessing the final moments of those patients?
How did I feel after I served in the team?
Yeah.
I think it was a very blessed experience and very valuable experience. I was happy, blessed, and thankful for being able to serve the people in New York. I think it will last. The experience last me a lifetime. Number one, it helped me it teach me. It taught me to face the death, especially people struggling with death in their life. That's number one. Number two, that it brings the experience of coronavirus very personal. Oftentimes that we see on TV, so many people die in New York on this day. So many people were admitted to ICU or admitted to the hospital. But when you went up there, it became personal. 800 or 600 or 700 numbers are not numbers anymore, but each of those numbers was a patient. Each of those number was a person behind that number. And there was a person that's struggling with to fight the coronavirus and who was struggling to fight for their life. And when a patient dies, it's not just a number, but it's a person in that number. And not only the person died, but it's a whole family that they carrying with them on. So there's many people who are suffering, that were just not numbers that we often see on TV or on the news. That's the second thing that I remember that I learned from this experience. The third thing I learned is that many times that we take things for granted in life. That there's many things that we enjoy in life every day. Going to a restaurant, out, to be able to practice medicine freely. But during this time, things change, and I learned to appreciate life more. The many things that we take advantage in our life, we don't pay special attention, but now these things are valuable.
Mm-hmm. Yeah, absolutely. I believe it's definitely a very meaningful experience for you. So, I'm wondering, have you experienced any stress, anxiety, or depression during the period?
Uh, I wouldn't say depression, but perhaps it's post-traumatic experience syndrome. That
Mhm.
when I go back to New York, go back to Houston, I still remember my experience in New York. I still remember who working to fight the war virus up there. I remember the patient that I served, the environment, a very unique environment that I served in at Elmhurst Hospital. Um, Everything was, people was wearing protective suits, and everything was so protected. So it's just a whole environment, and a lot of time that it just come back to me in memory. So I guess sometimes you can call it a post-traumatic stress syndrome.
Mhm. Yeah. So do you find any ways to combat the syndrome? Like, yeah,
Did I find any way to come back?
yes, combat the syndrome, like to really feel more relieved.
Uh,
Uh,
go back to
no,
reality?
to deal with the syndrome.
Oh, to go back to New York?
No, no, no. I mean, like after you return to Houston, do you find any ways to deal with the syndrome or like the anxiety you suffer or experience? I mean,
I'm sorry, one more time?
oh, okay. So after you return to Houston, do you find any ways to deal with the depression or like anxiety you face nowadays in Houston?
Um, well, sometimes that I still have anxiety about the experience in New York. Just like I share, it's a post-traumatic stress syndrome that sometimes that yeah, it remind you about the time that you were up there. Remind myself about the patients, about the coworkers that I work with, all the dangers, the environment that I was working up there with.
Mhm. Okay. So do you still keep in touch with people you encountered in New York?
Yeah, absolutely. Yes. We became very close friends, especially the team that I was working with. Once in a while, that I informed them going down here. I tell them that I still miss them up there, and I know that they're still fighting with the war of coronavirus up there. And I pray for them. And also, I tell them that I remember that the patient that we had opportunity to serve. Um, yeah, and I tell them that I hope that someday soon that thing will get back to normal for them.
Yeah. So can you give us a little bit update of what's happening right now in New York or like in the hospital you used to work for?
Yeah, I think the situation in New York is getting much better. Um, the uh, the Amherst Hospital itself is gradually going back to normal, meaning that many units that were converted to ICU units have been converted back to their original unit because they have less demand of the ICU beds. Um, there's less patient that being admitted to ICU. There's less patient being admitted to the hospital, and especially there's much patient with COVID positive in a hospital. At the time I was there, almost 100% a patient were COVID positive, but now the number has gone down really. Um, so in terms of that, I think the it's getting better, much better, and overall the number of deaths per day has been significantly reduced.
Mhm. That's great. I heard you also a very active community leader in several initiatives to serve our people in Houston during the COVID-19. Would you like to talk about that a little bit?
Sure. Yes, I'm very involved with the Vietnamese community here. Even before going up to New York, I'm organizing a group here to help the elderly people and on help with chronic disease go shopping, because as we know that that the government discouraged them go out, because when they, if they were to be infected by coronavirus, they can be suffer very severely.
Mhm.
So they should stay in house. So for those people, even before I went to New York, I was organizing a group to contact those people to help them go shopping, maybe grocery shopping, maybe to do uh, medicine shopping for them, and we help them do that to increase the chance of exposed to coronavirus. That's number one. Number two is we organize a group to make homemade face masks very early on in the coronavirus period, maybe beginning of April that we were making. No, actually, the end of March, we start making those homemade face masks already. Many hospitals down here were using it. Methodist in the medical center, Children's Hospital was receiving some. West Houston Hospital was also receiving some. So we were making homemade masks to help to provide to medical professional working in the hospital who were in short supply of face masks. Also, we have a group that show appreciation for the frontline people, a hospital worker, police officers, firefighters, by providing meals for them. Our community, our Vietnamese community in Houston, made many donations, and we were able to collect about, I would say, about $17,000. So with that money, we were buying lunch and dinner, and bring those meals to those frontline workers to show appreciation for their work and for their sacrifices.
Mhm. Yeah, that's wonderful. We appreciate your help, right, and your coworkers' help to our Houston community so much. So, what do you think the future of Houston community looks like in terms of like social interactions and returning back to normal?
Well, I think everyone will hope and wish that everything is gonna go back to normal. We just have to wait and see. So far, the social distancing has helped greatly to reduce the new coronavirus cases. So I think what we're doing is working, but at the same time that we have to get out and to get back to our normal activities again. People need to go back to work. People need to go back to their normal social activities. So see, but hopefully the weather change with the new cases going down, and especially with the vaccine, hope coming out soon, that will help us greatly in this fight for coronavirus.
Okay, great. Since you mentioned your involvement with Vietnamese community, I'm wondering like how did you feel hearing about like assumptions made about the Asian community as being more prone to the virus?
How do I feel about the Asian community?
Assumptions made about Asian community as more prone to the virus.
In terms of the cases among the Asian community, I think okay. Number one, first of all, I'm not sure about the different Asian community around here, but for the Vietnamese community, I know that the number of cases are very low, and the reason I know that is because in the past 3 weeks, I helped to organize the COVID testing sites for
Mm-hmm.
the Vietnamese community. So we were able to test about 600 patients in the past 3 weeks at a church location, at a temple locations, and of the 600 patients that we tested, only one came back positive. So I would say among the Vietnamese, maybe Asian community overall, the infection is very, very low comparing to maybe like I would say about 8% among the general population in Houston here.
Mm-hmm. Cool. I guess my original question was, how do you feel about like some racist attacks against Asians during the COVID-19 pandemic?
The racial bias?
Yeah, yeah.
Uh, well, I'm not sure what is the racial bias you're talking about.
Or racist attacks, I mean, like some racial discrimination or some, yeah, or some just attacks or prejudice against Asians.
Here in Houston, I haven't heard many of the racial attack on Asian. In New York, we probably saw a few video clips that Asian will attack on the train in the subway. Well, some racial bias is always wrong, and racial discrimination is always wrong. We cannot take a whole race as a whole as a lump sum. There's people that are infected and people are not infected, and in reality, among the Asian community, I think the infection ratio is much lower than in the overall population. So it's number one is a misconception that that the Asian community bring the virus here. I think it's a very misconception. Number two, as I share, that the infection rate among the Asian community is much lower than compared to the general population. And on the treatment according to race or to religion or to ethnic group. Yeah, it is, racial discrimination is always wrong.
Yeah, definitely. So I'm wondering, have you personally encountered any attacks based on your ethnicity or race during your time in New York?
Me personally, no, I did not experience that. But then people warned me to be careful in New York because I guess what they saw on TV from Houston. So it's always careful. But while I was in New York, number one, I worked in a hospital, and I did not feel any discrimination at all. And number two, on weekends, I went to I didn't have to work on the weekend, so I took a subway to go to New York City, and everywhere I went, well, actually there weren't many people at that time anyway, but when I just did not see discrimination or any racial bias.
Okay, that's great. So how do you feel we could come out of this pandemic stronger as a community?
Number one, I think the Asian community has shown good faith with the general population, especially I can talk about the Vietnamese community because that's the only experience that I have. And the Vietnamese community tried to connect with the general community around us in many different ways. Number one, we try to be helpful. And to be connecting, making face masks and give it to the frontline worker, police officer, firefighter, the medical community. So we try to connect with the overall community. Number two, as I share, that we bring meal to serve other people. So we try to live in this experience together with the general community. Number one, that we are a part of Houston. we are definitely a part of Houston, and we journey together. We fight this fight together. And number two, that we try to be as helpful as possible in with the general Houston community.
Mm-hmm. Cool. Will you consider a change in your career or your direction of community services as a result of the pandemic?
I have been active in my community for a long, long time,
Mm-hmm.
and we have done many different volunteer work. Me and a group went to many different places to serve people. Like, for example, we went to Haiti about 10 years ago when there was an earthquake that killed 100,000 people. So we went there for 2 weeks to help. We went to the Philippines about 3 or 4 years ago when there was a tsunami that killed about 100,000 people. So we went there to serve as a medical professional, and we serve our Houston community here during the Hawaii flood. So we have been trying to provide service as much as possible. So it's just nothing new for me.
Okay. I guess my last question is, if there are positive lessons learned out of this pandemic, in your opinion, what are the important ones?
One more time.
Okay. If there are positive lessons learned from this pandemic, in your opinion, what are the important ones?
What are the
important lessons?
Lessons. Important lesson?
Yes.
Okay.
Out of this pandemic.
One lesson is that there's many things that we are taking advantage in life. For example, is our friends, family, time together, activities together, and many things that we are enjoying in the life that sometimes we don't pay attention. But when these privileged things are taken away, then we really can appreciate what we have. So that's one of the things that I think is a very important life lesson that we can learn, to appreciate life as it is, and relationship with family and friends. Number two is that we can recognize that life is so fragile. Sometimes we think that we can live forever, and the things that we have in life will be there forever. But this coronavirus epidemic changed everything. That we can see that one day that we're strong, and the next day we can be infected by such a small virus, and it can really affect our life, and it can really kill us. So we can see that that our life is so fragile. And thirdly, is also not only our life, but everything that we have around us is also very temporary and very fragile, that they can be gone very easily and very quickly. Number four is I think religion is very important as well, that I think many people come to appreciate how much they miss when religion is gone. Just for the fact people were not able to go to church or to go to temple in the past 2 months or so, because they were all closed. And many people feel that they did not appreciate their participation before, but now they can really appreciate the time to go to those religious events. So there's many life issue, many life lesson that can be learned from this epidemics.
Yeah, definitely. Thank you for sharing your inspiring experiences today. I guess these are my questions for today. If you have anything else to add, you can take the.
Thank you very much, for your time. And it's my honor to be able to participate in this conversation.
Okay, me too. I'm very touched by the stories you shared. Again, thank you so much.
You're welcome. Thank you.
Okay, bye.
Bye-bye.
Mm-hmm.